Following portion of Daytime Tri-Cities is sponsored by State of Franklin Healthcare Associates. Once again, it is time to meet your provider with State of Franklin Healthcare Associates, and today we're talking to Dr. Kathleen Foster. Good morning, doctor.
Good morning.
Let's talk about you being from right here in Kingsport, first of all, a native of Kingsport.
Yeah, that's right. I grew up here. I went to Dobbins-Bennett High School, and I did go away for training. I went to University of Tennessee in Memphis for medical school, and then up to Connecticut for residency, and then been practicing in Raleigh for the past 10 years and decided it was time to come back home.
The mountains drew you home?
The mountains drew me home, but also the grandparents. So my husband's also from Kingsport, and both his parents and my parents live here in the same neighborhood. So we've got two little kids. It was too irresistible.
For Dr. Foster, family ties led her down the path to becoming an OB/GYN specialist.
My grandfathers on both sides of the family were physicians. They were internal medicine and family practice physicians. So I think they kind of spurned my interest in medicine in general. And I thought I would probably be a family practice physician, but then as I kind of got into the training, I realized that I really liked to deal with women mostly, that I like to have mostly young, healthy patients, but I like to follow my patients longitudinally, so be able to see them over years and years and establish a relationship, but that I also liked procedures and surgery. And so this field kind of combines all those things. The other thing that I realized once I got into training was that I really enjoyed interpreting ultrasounds and other imaging studies, and that was also a part of the specialty that I've enjoyed. So this seemed like a good fit.
Foster really enjoys having that long-term relationship with all of her patients.
Selfishly, it's just more gratifying, honestly, to kind of establish that relationship. I mean, I haven't developed that here quite yet because I'm the newest member of the State of Franklin team. But, over the course of my career, I might have delivered the same patient's babies multiple times, which is always fun. And then you just get to provide better health care if you know the patient better. So I love to have that opportunity as well.
And on a daily basis, Foster finds an immense amount of satisfaction in her chosen profession.
Not many people can say that most of what they do on a daily basis brings so much joy to other people, But to be able to deliver somebody's baby, I mean, I'm seeing somebody on what's usually one of the best days of their lives, So it's so important and so special to be part of that experience. I just feel so lucky that people allow me to be part of that experience for them.
And for Dr. Foster, having children of her own is a great adventure.
I have two little boys, a 2-year-old and a 5-year-old.
That keeps you busy.
Yes, it does. It does. Luckily, my husband's not in medicine, so his schedule's a little bit more flexible than mine. So I really rely on him to help me with the child care. But yeah, they've been wonderful, and they're pretty rambunctious, but they're so excited they're here around their grandparents now.
Talk to me what y'all do as a family. Let's talk about the personal side of things.
Yeah.
What do y'all do for fun as a family?
Yeah, we like to go up to Bays Mountain Park quite a bit. They love to see the animals. We like to hike around the lake. My son is a nut for space things, so he loves the planetarium. So we've seen all the planetarium shows. We have a pool in our backyard. We like to play in the pool, just go for walks, see the grandparents, that type of thing. They're so young, we can't get too crazy with our adventures, but we've enjoyed what's in the area so far.
And according to Foster, having grandparents nearby is the greatest parenting hack of all.
That's the truth, I'll tell you that. So, I mean, it's definitely been so much easier for my husband here. And in fact, usually my mom or my mother-in-law or father-in-law will come over for dinner a couple times during the week, and I love that. I just never got to do that, and my boys are gaining so much from that.
And in addition to being a great parent, Dr. Foster likes spending time at the potter's wheel and behind the lens.
I do like to do pottery. Okay. I used to have more time for that. With the two little ones, I don't get to do it quite as much, but I do have a pottery wheel at home, and I will occasionally do some pottery. I like to do photography. I usually do mostly landscapes. Have a couple of those framed pictures at home, and then like to go on hikes and just be outside.
And as she looks into the future of her profession, Foster sees some amazing things on the horizon for all of her patients.
Our prenatal testing is going to get a lot better. We've already made a lot of advances in terms of cell-free DNA fetal testing, which is really neat. We used to have to do an amniocentesis to kind of rule out things like Down syndrome, and now we can pretty efficiently do that with the cell-free DNA. So that's a really cool technology that I think is just going to get better and better. And my hope is that we're going to be able to do a lot of prenatal diagnostic work with that test alone. So I think that will be something in the future. I think we're going to continue to develop minimally invasive surgery. So a lot of these procedures that took a long time to recover from are now going to be day procedures, which is going to be amazing for patients. And then I'm always excited to see kind of the new therapies that they develop, medications, especially gene therapy and things like that. My brother is a biomedical engineer. My sister is a chemist and works for a drug company. So I'm always excited to hear kind of about what's coming down the pike in those technologies, because I think it's just an exciting time to be in medicine.
Thank you so much, Dr. Foster.
You're so welcome.
Dr. Kathleen Foster, great conversation for Meet Your Provider with State of Franklin Healthcare Associates. The preceding portion of Daytime Tri-Cities was sponsored by State of Franklin Healthcare Associates.